Ohio Food Policy Council Network for inviting me today. And, research very rarely ever happens in a vacuum. And so I just also want to say that I know a lot of the folks that are on this call today have been instrumental in helping to shape this research, the questions, finding farmers to talk to, and promoting the surveys, and also ground truthing what the observations were with your experiences. So thank you, everybody. And I'm really curious to hear your thoughts as all of this data that we've been collecting over the last 10 years resonates with you. I also just want to acknowledge that, again, I partner a great deal with Florence Bicot at the National Farm Medicine Center. She's also with the National Children's Center for Agricultural Health and Safety. So this presentation really represents the work of a lot of different people. So today, what I wanted to do is just really give you an overview of how I conceptualize and think about social sustainability in the food and agricultural system. Oftentimes, that's the most difficult to operationalize. And so I've been working for the last couple of years to really think about how do these issues of health insurance and childcare really fit into that social sustainability framework that we know is so important in our food and agricultural systems. Okay. There we go. So again, systems research is really complicated, and we know that there is a lot of different moving parts when we're talking about the food and agricultural system, right? And we like to really try to simplify it to say, okay, we're going to focus on both the social, economic, and environmental sustainability, right? And a lot of times we most often conflate social sustainability with economic sustainability, that if folks are just making more money, well, then their lives will be better. And those are the types of quality of life measures that we can look at. And what we really need to do is broaden that perspective of what is social sustainability, because it is very difficult to operationalize. And we see this also when we look at some of the economic development tools for farmers specifically. A lot of the focus both within holistic farm management, and then also we see through the federal programs like the Beginning Farmer and Rancher program, where we see a lot of investment in growing the next generation of farmers. And the investment really tends to focus on access to land, capital, labor, skills, market development, all of which are incredibly important, but we forget about those household and social issues that are so important for viable farm businesses. And really, when we take a step back, what we really see is that farm families, right, we tend to oftentimes judge an operator, their success or failure, whether or not they were a good business manager, whether they were a good producer, right? But we forget that farmers and farm families are really embedded in larger social systems, economic systems, and government systems. And when there are major policy shifts, right, at the national level, like whether it's the Affordable Care Act or debates about health insurance and childcare, those things are going to reverberate and have impacts on farm family operations, right? And we used to see a lot of this conversation, especially around health insurance. The other part, just to give you a little bit of theory, not a lot, but really when we look in the rural sociology literature and then rural studies literature, we really see how important the family is within the family farm, right? We oftentimes, again, tend to silo the business from the household, but in reality, they are interlinked and interconnected. And farm households play a really key role in bolstering farm businesses, particularly in the family farm, where a lot of times labor that the family is providing is actually not counted or being paid for monetarily, right? That's not an expense on the balance sheet. That's just something that's contributed. And all of those other household functions are also economic functions that keep the family and the farm going. So again, today, like there's a lot of different things that we can look at, but today I really want to focus in on this focus on health insurance and childcare and how they affect profitability and sustainability, getting access to affordable quality childcare and health insurance. And just to put this in a little bit broader context and some timeliness, is SARE, and I know many of you are very familiar with SARE, just released their first bulletin on social sustainability. And really thinking about how do we operationalize that. And I, along with a number of other colleagues, helped author this and trying to really give folks some more tools that you can use when you're writing grants, and to really kind of carve out this space as a very important space for the work that we all do. Okay, so first I'm going to go in and talk a little bit, talk to you about the health insurance research, and then we'll talk about the child care research. So this research actually started, oh my gosh, back in before 2007. on some previous projects. And we found is that for a long time, health insurance has actually been a big issue for farmers. Back in 2007, I was working on a national research project with Jill Clark and Doug Jackson Smith and Jeff Sharp, and we were actually looking at how farmers were faring at the rural-urban interface, so where folks are living where there's a lot of urban development pressure. And when we asked farmers nationally, what is the biggest threat to the future of their farm, it wasn't necessarily the income from my farm or threats from urban development or suburban development. It was actually the cost of health insurance, right? So this was a really big, interesting, surprising finding. And what flash forward, then you 2010, the Affordable Care Act comes into place. We know that farms are actually one of the most dangerous places to work in America. They have some of the highest injury rates. And farmers, again, for a long time have had issues accessing health insurance. And here we had this major experiment coming into place where the Affordable Care Act was supposed to create free up folks from job lock, where you are really locked into the job that you're at because of the employment options that you have. Right. So like, how is this going to actually affect the agricultural landscape? The Affordable Care Act was supposed to stimulate entrepreneurship. So really wanted to understand what was happening in this space because of this major policy shift, and got a USDA AFRI grant. It was an integrated research and extension grant to really understand how is health insurance impacting economic development through food and agriculture, and look at those lived experiences about how is it affecting workforce vitality, risk management, quality of life, family health. And so our project is called Health Insurance, Rural Economic Development in Agriculture, or Hired in Ag for short. We conducted, it was both qualitative and quantitative, did some focus groups with folks in extension and technical assistance research folks. Not going to really present on that today. We did do some really interesting work within the farmer field. We looked at the 4 different regions of the country and looked at 2 states per region, dividing them about whether or not their state expanded Medicaid, right? So we had this really interesting policy variable that had happened. And we conducted both interviews and household surveys in each of these 10 states. Just to give you a broad overview, our sample was really representative of the national farm population, and we got a really good representation of both multi-generation and beginning farmers that were in our sample. Okay, so we know that when farmers are making decisions about health insurance or any decisions, right, they often are wearing 2 different hats. They need to make decisions for themselves and their family, and also for their employees, because they are oftentimes employers. Today, we're only going to focus on the individual and family. We do have a number of research briefs and articles that we've written about the decisions that farmers are making as employers, and I'm happy to send those along for those who are interested. Okay, so overall, actually, farmers are a really well insured population. They're actually better insured than the general population. And the very few who weren't insured actually just cited the high cost of premiums and deductibles. What's really interesting is in our survey data, and this matches onto USDA data, that the farmers who are the least likely to have health insurance are dairy farmers. And that is because they are the least likely to have off-farm jobs, because the vast majority of farmers are insured through an off-farm job, right? And you probably know many farmers where they themselves or a spouse are working off the farm, both for additional household income, but primarily also for the benefits. Among farmers that were not insured, they're still very cognizant of their health, right? They talked about using food as medicine, chiropractic care, even bartering for health care, right? So still needing to be very conscientious, and because they know that they have a very dangerous job. What was also really interesting is to see how farmers were actually insured. How many of you love to read through your health insurance plan and really understand your plan, right? And where you can get your prescriptions and what's covered and what's not covered and what percentage, right? It becomes really overwhelming really quickly. And what was interesting is that we found about 1/3 of the farm families that we surveyed actually had more than 2 plans in one family. And that means that not only do you get the pleasure of going through one plan, but you have to navigate 2. And again, 3/4 of the sample really said that health insurance was an important risk management strategy. So when we think about risk management and the way that that's defined, oftentimes we really think about it in terms of crops. And oftentimes in the risk management guides, there is a little box about health insurance. Do you have it or not? But we really need to, I think, expand that box and think a little bit more holistically about how farmers are thinking about the way health insurance is a part of risk management. What was also really existing is, especially because of both shrinking and aging farm population, we have an aging farm population, and 64% reported that they have a pre-existing health condition, and 40% report that they or someone in their family have a health condition making it difficult to farm. Right. And so these are real issues that will affect your access to health insurance, and then also the ability to get work done on the farm. So, I can talk to you a lot with the PowerPoint, but I also wanted to share some of the video that we made. We worked with a professional videographer to try to translate some of this research into more accessible understanding of what's happening. So as you watch, I'd love for you to reflect on what did I hear or learn that was familiar? What did I hear or learn that surprised me? And also, how does health insurance affect efforts to grow the next generation of farmers? Because I know that that is definitely an issue that so many of you care about. And I know Amanda is going to help me also to, let's see, sorry, I've got to share the screen. You'd think after all this time, I'd be used to doing it. It's going to help me navigate the chat as well. Okay, can you all see the screen okay? The video?
Yeah, we can see it.
Okay, I'm gonna make it big screen too.
In 2007, Memorial Day weekend, with a house full of Girl Scouts, my husband fell off the tractor and broke his neck between C3 and C4. Bob needed emergency surgery because every time he moved his head or hands, he'd have electric shocks running up and down his arms.
Beth and Bob Kennett of Liberty Hill Farm are multi-generation dairy farmers in Rochester, Vermont.
Over the years, we've had several medical issues that have arisen. Everything from our son David having a genetic kidney condition to my husband Bob falling off the tractor and breaking his neck. I'm very concerned about healthcare and healthcare and insurance. It's really, really important for our family.
Farming is among the most dangerous occupations in the U.S. Injuries and illness result in lost work time that can have serious impacts on the business. Health is part of workforce development. Healthier farmers and ranchers are stronger, more innovative, and better able to cope with stress and adapt with disruptive events that come with farming. If farmers and ranchers can't access the health care they need, the future of the farm is in jeopardy. The goal of the nation's USDA-funded health insurance, rural economic development and agriculture project, also known as Hired and Ag, is to understand how health insurance affects both the economics and quality of life for our nation's farmers and ranchers. The farm business and farm family are often treated as separate entities, but the two are intertwined. 3 out of 4 farmers say health insurance is an important risk management strategy.
There's something going on the farm 24/7, 365. It never stops. There is no break. It never lets up. And that constant burden of responsibility is difficult physically, it's difficult mentally and emotionally. Health insurance has been a routine part of our budgeting plan for the farm to provide that health insurance for the entire family.
The majority of farms and ranches are family businesses. Their access to health insurance varies by their age, if they have children, structure of their enterprise, and their values. The majority of farmers over age 65 are insured through Medicare. For farmers and ranchers under 65, there are multiple options. 32% of farmers report 2 or more health insurance plans within the same family. A divorce, death of a spouse, or job change can affect a family's health insurance options. The U.S. farm population is aging and shrinking. With an average age of 58, farmers are vulnerable to higher insurance premiums. 2 out of 3 farmers report having a pre-existing health condition. Just over half of farmers are not confident they can pay the cost of a major illness without going into debt. And almost half are concerned they will have to sell their farm assets to address long-term health-related costs, such as nursing home care.
Farmers tend to be cash poor and land rich. Farmers and ranchers are going to either need to farm longer in order to be able to afford retirement and long-term health care needs, or they're going to need to sell their land for a higher price in order to be able to retire, and that sale of land may go for non-farm development. Land is often one of the most expensive and difficult barriers to overcome for young farmers in trying to begin their own operations. All of this adds to the bottleneck of land access for young farmers and ranchers.
Young and beginning farmers identify access to health insurance as one of the most significant issues impacting the future of their enterprise. It is especially important for families with children. Young farmers access health insurance through a variety of ways. In this sample, almost half are insured through a public option. Young farmers report having more options removes the need to be locked into a full-time off-farm job with benefits, thus freeing up time, energy, and money that can be invested into growing their operation. Health insurance affects rural development efforts to build vibrant, prosperous rural communities. In this sample, 72% of farmers between the ages of 18 and 64 have an off-farm job for additional income and health insurance. Almost half of these farmers are insured through public sector jobs in the fields of health, education, or government, compared to 1/3 in the private sector and 20% in the nonprofit sector. Changes in employment and benefit options affect the financial stability and social well-being of farm families, with impacts reverberating through rural communities.
Give a farmer $1 and it multiplies like crazy, because we will spend it, and we will spend it locally. Yes, we're going to buy sawdust. Yes, we're going to go to the hardware store. Yes, we're going to go to the local gas station and the local fuel dealer, and we will spend it, and we will spend it in your community. However, what we contribute is not just milk. It is the stewardship of the land. It is the stewardship of our resources. It is providing open space, wildlife habitat, recreational opportunities. It's providing a part of the community. We provide mentoring opportunities for the high school kids in town. We're part of the 4-H system with the university. We're part of a lot of different community organizations. We are stewards not just of this farm, but of what this farm means to our valley and to our community and to our state. It's those parts and pieces that if we are not able to continue farming, that's what's really going to be lost, is that contribution to community that our small farm has. That's the real impact.
Okay. So do folks have any reactions, thoughts? How did this resonate with you? Put it in the chat or unmute yourself.
I think I'll have to directly unmute them.
Oh, sorry.
It's okay. Do you want me to do that?
Sure.
Okay, it'll take me just a second to go through and promote everybody to panelist. And they can stay muted if they'd like to. It's up to them. Everybody, I'm clicking allow to talk. If you have an older version of Zoom, I know it won't allow you to be unmuted, so.
Okay, it says the chat is disabled.
Oh, weird. I wonder why. Let me take a peek. It's set up to be open, but I know sometimes it does that.
One of the other fun facts on that video is the narrator is also a farmer. So,
Okay, it should be set. Everybody is everybody can chat with everybody now. So if someone wants to give it a test.
it's Does anybody have any thoughts or reactions they'd like to share?
I see Beth said it all sounded familiar.
It all sounded familiar. Yeah. Yeah, I think it's, it's kind of some of those things that maybe we've all heard before in passing conversations, but the degree to which we've really paid attention to it, I think has really, really varied. So I'm just going to go over a couple of the other points that were brought up in the video and some other parts of the data. There's a lot of conversation also about like what are the other ways in addition to health insurance that might be beneficial for folks to navigate health insurance. A lot of talk about health savings accounts and flexible spending accounts, but these were not really predominantly being used by a lot of the farmers in our sample, which I think is also really interesting. Another part is when we think about and look at how, in addition to just medical insurance, oftentimes dental and vision insurance are separate types of plans and need to be purchased. And what we saw is that while the majority had prescription drug coverage, less than half of the sample had dental or vision, and that actually tracks with the majority of Americans. And especially when we think about in agriculture, where we have an aging farm population that is oftentimes driving very large equipment and also dealing with chemicals, to not be able to go for glasses and get updated prescriptions is a real safety hazard and really becomes an issue for farm safety. There's a lot of conversation around farmer mental health. What was really interesting is that about a third of our sample didn't even know if their plan covered mental health, right? So there's one thing about, does your plan have it? Another, do you even know if it's available and what is even being covered? So again, this is a really important part of when we're dealing and addressing mental health, is actually thinking about what is covered and do farmers know how to even understand or know where to look to see what type of coverage they have. Another underappreciated part about health insurance is how easily your needs change, or how often your needs change, because your needs when you're very young are very different when you begin to have a family, have young children, right? All those child visits, and then when you're actively aging, all of those different parts of your life course require different amounts of health and wellness supports. Also, your access to health insurance can really change with your, if you have a change in a relationship. We talked to farmers who had great health insurance until they got divorced and their health insurance was through their spouse, and then they just completely lost access to health insurance, or if their spouse died. If you're fired or let go from your job, right, you can lose access to your health insurance. So all of these things can really affect the way that we are insured and the precariousness in the ways that folks are insured. We also saw how access to health insurance affected people's production systems. So this is just a really interesting story of where we talked to a multi-generation farm couple in their 50s. They had a really great, one of the partners had a really great off-farm job, actually the university, really good benefits. The individual then developed throat cancer. And at the same time, the university was downsizing, so they lost their access to that health insurance. They lost their access to that job. They had these significant health issues and were really scared, and they went onto the individual market plan. And they were actually said it's so hard to figure out what to do, and we're so scared because we want to have really good coverage like we had, but we don't want catastrophic, but we don't understand the plans and they're really expensive. And they talked about the shame of not understanding the plans, even though they felt that they were pretty well educated, right? And they, actively crying. They also talked about how this had really changed their production system. Prior to this, they were really actually doing a lot of direct marketing at the farmers markets, selling produce. But because of the person's throat cancer, they lost their ability to speak. And so they couldn't do any of that direct marketing. And we're now looking into some livestock options that did not have to be direct marketed. But you can see how directly tied, right, that access to care and the quality of care you're getting are also going to affect your ability to recover from any kind of health issue. We also heard about farmers actually really delaying healthcare until they were eligible for Medicare at the age of 65, talking about extending care out until then, right? Saying once I hit 65, everything was great. The other thing is that a small minority of folks were actually participating in the Christian managed healthcare plans. But the thing to know about these plans is that they don't actually cover preventative visits. So for example, one grower told us that they needed to have the shingles vaccine. Their plan wouldn't cover it, so they were just going to wait a couple years till they were 65, and then they would get it, even though their doctor said that they should get it now. Another person told us that their children needed vaccines. These plans didn't cover it, so they were going to use the county's health program. So there's a lot of different ways that these things are also being managed. Right, when we think about farmer debt, right, and being able to stay afloat, we don't often account for how these issues of health will affect farmer solvency, right? 52% of farmers in our sample said that they could not pay the costs of major illness, and 45% said that they were concerned they're going to have to sell some of their farm assets to address health-related costs. And that's pretty significant, right? And where is that going to go, right? We know that farmers are most likely going to get the most money for non-farm development. So all of these things really contribute to this bottleneck for the next generation, for getting access of land to the next generation. So it's something else I think we really have to layer on and think about for so many of us who are working in this space. Now, a lot of this data, right, is a little bit older, where it comes out from 2016 when it was collected. But, you know, Doug Jackson-Smith and I, we run the Ohio Farm Poll, and we asked in 2020, what were the big sources of stress to your farm business? And you'll see health insurance costs were just there in line as market prices and future to farm, right, and farmland costs. So, right, weather, especially that year, was really, really bad, but health insurance is just as much up there as these other concerns. So it's still a significant issue today as it was a few years ago. And just to kind of give you another sense of how this actually affects people's lived experiences, we spoke to one rancher out west. He tried to inherit his family's farm, didn't get along with the dad, some issues, so he went out and purchased his own land. But in order to make enough income and really for the benefits, took a job with NRCS and drove about 45 minutes in the commute, and really said, you know, my job is so stressful because I'm trying to figure out, how do I farm? How do I spend time with my family and be a good father? And at the same time, how do I make sure that I'm being a good employee at NRCS so that I don't get fired and lose access to benefits for the family? And other farmers shared, you know, they said, I think that my family would be better off if I could work part-time, and if health insurance was just offered at 30 hours a week. And it is in some places now. You get more done, so you're not doing everything at dark at 11 o'clock at night. So this is a really important part also, right, about the ability to get health insurance. Farmers really recognize they need a lot of those off-farm jobs to provide capital infusions into the business. But when they're locked into that 40+ hour work week, that makes it a lot more difficult and stressful for their lives. So another example of what happens if we really don't address this and how health insurance can really affect the future of our farming population is we spoke to one farmer in Pennsylvania who had a dairy farm. He got an accident where one of the cows laid on him and got pretty badly hurt. He did not have health insurance that would cover any physical therapy, and he couldn't pay the bills, and he couldn't maintain the farm, especially with the physical condition that he was in, and couldn't recover. And so he actually sold the farm and became an airline pilot and left agriculture. So these are some of the real world consequences that happen because of health insurance. Just very quickly, we did ask a question about whether or not folks offered health insurance to employees. And in fact, just under 10% actually did offer health insurance to the employees. Most of them were in Hawaii, interestingly enough. And then also the majority of them were actually value-added producers. And so what we see is that producers are really trying to offer health insurance as a way to retain highly skilled employees. And on the flip side, folks talked about how hard it was to maintain employees because they weren't able to offer health insurance, and folks were looking for other jobs that could give them those types of benefits. So when we're talking about economic development through food and agriculture, we really have to confront the types of benefits both farmers and farm workers are getting in these occupations. Okay, so when we look at those folks who are under 64, so right, if you're over 65, you get Medicaid. What we really see is that the majority of folks are really getting health insurance through an employer-based plan. And the majority are actually insured through the public sector in health, education, government. And especially during COVID, when there's a lot of conversations at the beginning about that we need to cut back on costs, particularly for public services, right, in local government, hospitals. We tend to forget that those tend to be the best paying jobs with the best benefits, particularly in rural areas. And so we forget that if we're making cuts, right, because it's going to be more efficient and cost savings, those are going to have repercussions across our farm populations and across the stability of our farm families and our agricultural systems. So it's really interesting to think about, right, how is health insurance actually tied much more broadly to rural development in ways that we may not always have appreciated. We also focus a lot in growing that next generation of farmers on those 18 to 35-year-olds, right? And Farm Credit has all kinds of special programs targeting these young farmers. And farmers really in this age group talked about the importance of actually having parental coverage to age 26. Many said that when they were coming up on 26, on 27, they were like, it was like looking at a cliff, right? And were really scared about what to do. And they said that the subsidies that were available in the marketplace and also through the Medicare expansion really gave them a lot more options. And in fact, 2 out of 5 are enrolled in public health insurance plan. Where we really see this come to play is for young farm families with children. And we heard a lot of tensions where folks are trying to figure out, right, do I send my child to daycares, or do I get an off-farm job that would provide me with health insurance, but then I have to figure out who's going to take care of my children, and childcare is really expensive, right? Or do I keep my children at home? I don't go for that off-farm job. And also that way the children can get health insurance, because especially for CHIP, the Child Health Insurance Program, a lot of farmers rely on that for their children. And that has an income cap. So if you go just a little bit above that, right, you become ineligible. And so farmers were actually actively deferring job opportunities that could help with cash infusion in their farm for that. So again, kind of caught in this middle of how health insurance and childcare are connected. So I want to move a little bit more now into how the research that we've been doing around childcare and why it's so important. I do a lot of this work with Florence Bitko. As I mentioned, she actually used to be at Ohio State, and now she's at the National Farm Medicine Center. Childcare is really important for a number of different reasons, but it's been a particularly important issue in the farm safety world. Every 3 days, a child actually dies in an agricultural related incident. And most of those are agricultural related injuries are sustained by non-working standing children. And farm safety experts have really emphasized for the last 20 years that the safest place for children is off of the farm. But they've never actually said or asked, well, where are the children going to go? What are the childcare options? And so Florence and I, we've been studying this issue for a really long time to understand how childcare supply, especially in rural areas, which oftentimes are childcare deserts, affects farm productivity, the division of labor, the types of decisions you're making about your farm, how it affects the overall well-being and overall of the farm family and overall rural economic development. What's been really interesting is how invisible this issue has been in our conversations around farm technical assistance. When we ask farm service providers and organizations about childcare, we get these questions, we get these answers of, it's not an issue for farmers. Their farmers don't bring it up. There's no funding to talk about that, or that's the household and we only focus on the farm business. And active, like, I don't want to talk, I don't ask about it. I will say that since the onset of COVID, there's been a lot more conversation and interest in talking about childcare. And I'm going to talk about that a little bit more later. But this is still the predominant paradigm, right? When we think about farm assistance, that childcare is the household. We don't touch it. We only focus on the farm business. But when you ask, is it a problem? In fact, it is. And we actually have evidence going back to the 1980s where surveys were done with rural families and farm families, and farm women said that they wanted USDA to pay for childcare so that they could further their own agricultural careers. The research I did more recently in 2014 and 2020, 2/3 of farmers are reporting nationally that they have challenges with affordability, availability, and quality of childcare. And what's interesting is that both men and women experience these childcare issues similarly. And while both first generation and multi-generation experience them, they're more of a significant issue really for first generation farmers, especially because a lot of those folks are moving out to and finding land where it's affordable based on quality soils and markets, and not necessarily where they have a community and folks that can help support them. Right. And again, this issue of farm safety. How are you supposed to get a job done with equipment with kids running around? Kids get in a blind spot and can be killed. And this is really a significant issue, right? And one of the things that we know is that childcare needs actually change as children grow. The needs of infants are going to be different than toddlers, elementary, middle schooler, and high schoolers. So we think a lot of the focus in the media has really been on those early preschool years, right? And infant care, which is very, very hard to get into and also very, very expensive. But childcare doesn't end there, right? It continues going on. So I wanted to share with you some of the results of our study that we've been doing that's been funded by CDC that actually looks at childcare and how it affects economic development and also farm safety. So this is a 4-phase project. We started out doing an environmental scan of 101 farm programs and resources and did key informant interviews with 38 different individuals in both the business, farm business and also childcare sectors. And then we did focus groups with women raising children on farms, focusing on the 3 states of Ohio, Wisconsin, and Vermont, and then did a follow-up photo voice project with them, and then just did a farm household survey nationally in the last phase. So I wanted to share just some of the high-level results from this research. So one of the things that we found in our environmental scan is that there's basically hardly any mention of children or childcare in any of the service providing, the types of resources that are provided online. And that does vary a little bit. So farm safety materials and individuals who work in farm safety are actually more likely to integrate children and childcare into the programming, usually by talking about designing safe play areas, what is the right age that children can use certain types of equipment. But there's no real practical guidance on how to actually identify and access childcare. What we also found that beginning farming and ranching programs and also women in agriculture programs were not very likely at all to talk about childcare at all. Sometimes it's mentioned, maybe like think about this, but no real guidance on how to think about it in what ways. Farm organizations actually had the widest variation in how they were covering health insurance and childcare and the way it connects to farm business development and also farm safety and quality of life. And it could be from just barely mentioning this as an issue to actually convening peer groups of farmers to share stories and writing articles about this, or having conference sessions and virtual support groups, to some nonprofits actually actively advocating in the policy arena for better childcare support for farmers. So there's quite a bit of variation. So I wanted to just give you a high-level overview of also what we were hearing from these focus groups with the women. And rather than get into just the focus groups, I wanted to share with you some of the pictures and quotes that we heard from the Photo Voice project. So what happened was we were actually stunned and overwhelmed by the amount and number of women that wanted to participate. Our goal was for 36 women in the 3 states of Ohio, Wisconsin, and Vermont to participate. And we gave ourselves 5 weeks to recruit. In 5 days, we had 108 women sign up. We did 13 focus groups in 2022. And then we invited the women to participate in a photo voice photography project. And 33 of those women decided to participate of the 67. And we actually have 377 pictures. And so I'm just going to give you an overview of the stories that they shared. Also, just to let you know, what is Photo Voice? It's actually a participatory and visual research methodology where the participants take pictures based on some prompts that we give them to actually show what their real lives are like, right? And to allow them to have ownership and in the research as well. So the pictures I'm going to show you are the ones that the women chose to share, right? They're representing their lived realities. And also just to let you know that some of the pictures are not always in line with the farm safety recommendations, but both Florence and I really feel that it's important to show the reality because we can't fix what we can't see. So this is, we heard so much about how many, farmers women are loved to raise their children on the farms. Our kiddos love to help simple tasks like carrying empty calf buckets. And you see how families are really integrating their children into everyday farm life. The boys are helping me refill the freezers in our farm store. And the mom talked about how important it was. She made sure that the kids were wearing the right kind of gloves so that they weren't burning their hands on the freezing cold ice meat. It was also really important for these farmers to talk about, you also have to slow down, right? And a lot of times we have in agriculture this mantra being efficient, efficient, efficient. But when you're bringing children along, efficiency is not necessarily your goal. And it takes time, right, to teach children how to do these things. And so we really need to rethink a little bit about how we're framing maybe what is success in the farm and what is success for the family, especially as we're trying to grow this next generation of farmers. If it's not fun and if it's not a safe environment, right, who's going to want to go into it? Here's another picture from a dairy farmer who said, in this picture, my kids are playing on their own personal jungle gym at the farm, but they're in a safe place where the cows can't turn them over and only a few steps away as I milk the cows. And this is, again, a really important part where I think a lot of times farm safety experts are super well-meaning, and it's always about focusing on farm safety. Like, parents need to know that these are dangerous work environments. And what we found is that really parents know that these are dangerous work environments. But a lot of times why they bring the kids to the farm is because, they don't have anywhere else to take them. And we found that farmers are being really innovative in figuring out how to both work and have young children. So this individual actually was using their deer camera. They hooked it up to be, when they're for deer hunting, to their cell phones so that they could be in the nursery, but also be checking on the baby while they were working. And so there's a lot of really innovative ways also that parents are using different types of technologies to also allow them to work and keep an eye on their children. This is another really interesting point that folks brought up. They said, women brought up that making sure that there's a safe place on the farm for the kids to play is really important. And here they used a horse round. They turned it into a playground because it was actually all fenced in. And one of the things that the women brought up is that, we have through NRCS and other programs, money for fencing to keep cows out of the stream, but there's no money for actually safe play areas, right? And that's one of the #1 recommendations farm safety experts make, is that you need to have a safe play area on your farm. But the financial cost of doing that can be actually very high. And so one recommendation is really thinking about how could we create some of these types of supports that will allow for safe play areas. Again, we also want to bust the myth that farmers are not using childcare centers, or whether they're in home or at somebody else's house. This is actually a big myth that farm families only want to do it on their own and have actually able family nearby. In fact, a lot of times we talk to folks whose own parents or in-laws were actively aging, couldn't take care of the children. It wasn't safe to leave the children with them, or they just weren't around and able to help. And many talked about also the benefits of having their children at a childcare center where they could get extra socialization and provide enrichment that they couldn't themselves provide. They also talked about the frustrations and the hard days when daycare closes one day, right? When kids are sick, and then you have to figure out how to get work done with your kids, whether that's on the farm or for your off-farm job, and that can be really, really stressful. And women talked a lot about the stress that they experience from childcare. Again, they brought up that a lot of the mental health work for farmers right now is really focused on the producer and is very much from a male perspective. And we were really surprised that in almost every focus group we ran out of 13, at least one person brought up postpartum depression and how significant of an issue that was. And how much these childcare issues and navigating them make them stressed, anxious, tired, right? That they had to do all of this other housework, right? The meal planning, the work schedules, the kids' schedules, the cooking, the cleaning, the farm needs, all of that, right, falls onto the women, and that creates a lot of stress that can be also really exhausting and feel very isolating as well. So what are we doing with all these pictures? Well, our goal is really to, we're going to have a photo voice exhibit. We have working on that for online, but we're trying to find some funding to actually have that to create traveling experiences and having the women curate these photo voice exhibits. And these women have really interesting ideas of where these photos should go, everywhere from the halls of Congress to their rural post offices, and to really spark a conversation about these issues. We just did our household survey data, our analysis. We did that in 2023, and we had is close to 900 folks from across the country responded to the survey. So we have, and they're really representative of the national farm population. And so Florence and I are trying to get that out in the next couple of days to share with you what we learned from that survey. So what are just some of the implications of all of this? Well, when we're thinking really about how does health insurance and childcare affect farmers and rural communities, we really see that this is actually a rural development issue at its core. When we're talking about workforce attraction and retention, right, that at its core, one of the quality of life indicators and issues are, right, what kind of healthcare is available, what kind of childcare is available. This is also an issue not just for farmers, right, but also actually a lot of the rural hospitals are having a challenged recruiting because there's no childcare available. And farmers also don't have 9-to-5 schedules, right, like which a lot of formal childcare centers are set up for, right? They need childcare on the weekend, in the early mornings, in the late evenings. And it's very much akin to a lot of rural areas that have factories that are operating on 3 shifts, right? So we need to think a little bit more broadly about what are the types of childcare solutions. And we see how both health insurance and childcare really do affect farm productivity and quality of life and farm safety. All right, these are really important issues. And what we see and don't always appreciate is how these issues can really undermine our efforts to build that next generation of farmers and also ensure our national food supply and our security. These really have the potential to undermine a lot of the efforts that the USDA and others are making in shoring up our food system. So most of you know I had both the research and extension position and really try to translate a lot of this work into research briefs and also articles for outreach press. We had some articles in the conversation that some of you may have seen. We are actually working on one right now about the myths in childcare to help support efforts to inform the 2023 Farm Bill. And that should be coming out very shortly. We also have different guides to help farmers make decisions about health insurance and childcare that we've been developing. And I know this group cares a lot about policy. And so from our survey work, these are all from our national surveys. What's really interesting is when we ask, should USDA represent farmers in national health insurance policy discussions, 74% said yes. Right. And then this is from our most recent data with our CDC study that just was collected this winter. When we asked about USDA representing farmers in national child care policy discussions, 71% yes, and 76% would like farm organizations to represent them in national child care policy discussions. And child care has really become a big issue this year. And we're just reflecting on this research, right? It's not just for the policy impact, but also for the personal and the empowerment it is having for the folks who are participating in this research, right? That folks just really needed an outlet. And I have to say that this is some of the most moving research that I've ever done, where we've had farmers crying and thanking us for doing this research. And it doesn't matter what you grow, how you grow it, where you grow it, right? If you're in an urban area, suburban, or rural area, everybody has a family that they care about and who they love and who they want to be healthy, and children that they care about who they want to be safe and healthy. And so these issues are really the ones that really affect all of agriculture. And what we saw recently in the last few months is that American Farm Bureau, National Farmers Union, and National Rural Health Association actually all wrote letters and have included access to affordable childcare in their 2023 Farm Bill priorities. And both Florence and I have been working with Senator Brown and Senator Tina Smith's office in Minnesota to work on a farm bill, marker bill to actually start to address these issues around childcare through rural development. So we're really excited that we're seeing really this unity around these different issues and really starting to recognize them and talk about them so that we can really make sure that we have a very vibrant, prosperous farm population and rural communities. So thank you.
Thank you, Shoshana. There was one question in the Q&A, and I think you kind of already answered it, but they were asking, what type of childcare farmers might be looking for, whether home-based or family kin care. So I think you kind of dived into that a little bit. And that question was from Jamie O'Leary. So everybody does have the ability to unmute themselves and, interact with Shoshanah directly. So Jamie, I don't know if you wanted to kind of dive into that a little bit more, or if you felt like the content that she had shared really covered that for you.
Yeah, you touched on it a little bit. Hi, Shoshanah. I think, yes. So in the childcare world, we see a lot of family-based care in rural communities, in part because there's just not a lot of center availability. So I'm just curious. I know the state wants to create more rural and family-based, if that's something they prefer and would send to like a neighbor's home or like a co-op or collective sort of situation among other farming families. Yeah, anything on that would be really interesting.
Yeah, Jamie, thank you for that really great question. And we did ask that specifically in our survey that we just got the results back from, and we asked for those varieties of different ways. And so I don't remember the numbers off the top of my head, because like I said, we're just in the middle of doing the data analysis, so I can get that to you. But there were really like a variety of ways, right, that folks wanted to look at. And I think one of the other things that we tend to also underappreciate is the important role that schools have in providing childcare. So it's also thinking about both in those early years, but then as kids age, for really good quality before care and after care school programs, and also summer camps, right? That's another part. But yes, there was a whole different variety of whether that they would want center care or really good quality in-home care. Both of those were desirable options. And I can get you those actual numbers when we do the final data analysis.
Thank you.
All right. Anybody else want to ask a question directly, or you can also use the Q&A box if you're in a place where it's sort of noisy. Shoshanah, I thought maybe one question we could maybe, or small discussion. I know when you and I were doing the sort of practice session for this, right, to open it up today, you did kind of briefly mention the Farm Bill. And so, are there opportunities within the, Farm Bill to kind of address some of these issues and concerns that you've been, sharing with us?
Yeah, thanks, Amanda. That is a really great question. And one that I actually wanted to bring up is that, I think that like I mentioned, that there on the Senate side, there is this marker bill that is being developed and with bipartisan support, which is really exciting to see. On the House side, it's not clear yet who might be championing this legislation. And so I think if you feel that this is important with the organizations that you are a part of, right, to really share that, right, and as these bills come out, to voice your support. You've been working and talking with some of the women in agriculture organizations about this. I will share that with the bill that is being developed, it does not, it's in the rural development header, and it's not using any new dollars. So it's using existing rural development dollars to help really shore up and expand offering for funding to both build the physical infrastructure, the childcare centers, and also to work on the quality of those. So really thinking about professional development of childcare providers and being able to increase access to education for those folks. And then Jamie, you may especially be interested, I think that the way that they're defining childcare in the Farm Bill right now is before kindergarten, up to kindergarten. So, if folks have thoughts, I think that those are things that as these market bills become released for your organizations to talk about and have conversations about.
Thanks, Shoshanah. Has anybody else had a question come up or pop in their mind?
Hi, I have a question. Were you finding that these farm families were opting for more high premium or high deductible plans so that they'd be hit with either, that ongoing payment, or in case of an accident, a huge bill?
Yeah, that's a really great question. And we do actually have a research brief all about that. And so I'm trying to remember right now what the exact data was on that. So I don't want to misspeak, but I do know that those were the active kind of conversations that people were having, and many were actively choosing to have a more substantial plan that could cover any of those types of incidents, especially if they had children, than to go with a catastrophic plan because of the challenges with that. I will again also say that a lot of farmers have struggled with, especially if they're on some of the open market and expanded Medicaid plans, because of the variability of income in farming. And also when you need to do open enrollment, which is in November, right? And the fall, that's also a lot of times the prime harvest season, especially for farmers in our northern latitudes here. And so there can be sometimes a mismatch of when farmers are able to think about these issues and when open enrollment is happening, right? And when we actually do our extension work to like help farmers make decisions in the winter, right? So I think that there's also this issue of timing. And then a lot of farmers have shared, because of their fluctuating income, right, that also affects what they can afford to get when they're on these plans. So it becomes really complicated in that sense of the, and this is also just akin to any kind of small business owner, right? Any independent business owner is having to negotiate these things as well.
Thank you.
All right, any other questions from the group? All right, I don't know if we've got anything else coming in, Shoshanah. I did want to ask, I know you said you have this newer data set that you guys are still in the process of cleaning, but is there maybe like a web page or a landing page where some of this research is housed so that the group can kind of stay up to date with this work as it develops?
Oh, sugar. Sorry, I was trying to get to the website to put them in the chat. I'm so sorry about that. I should have had those ready. So I will do that. I will say that our health insurance website is not right now functional because of a server domain issue. But I'm migrating that one. But I do have some of the things up. But let me put this in for the childcare one. That's one of them. We've got a couple different sites. That's the one for the childcare. And then I will send you to like our project. Let me send you to this. So the Center for Community and Working Landscapes is the website that Doug Jackson Smith and I run that also includes all of the different projects, both the health insurance, childcare. It includes the farm poll, the Ohio farm poll, and also the Ohio structure of ag data. So all of our projects are there. And so that might be, again, some additional resources that may be useful for you all can be found there with links to all of these other websites as well. Yeah, thanks for the reminder on that, Amanda.
Oh yeah, Beth's got a question. It says, do you foresee a time or interest from farmers based on your research that Farm Bureau, Farmers Union, and others will band together and advocate for universal health care, universal pre-K? If not, what do you see as the barriers to that?
Oh, that's such an interesting question. And I think those are really important internal conversations for each of those organizations to have. And I think that there's a lot of different voices within those organizations. So back in 2017, I was at National Farm Bureau's annual meeting in Tennessee, and was presenting on the health insurance research, and the farmers in the audience were asking, well, what do you think is the answer? So I said, well, what do you think is the answer? And it was really interesting because folks said everything from, we need fair plans and things that are more transparent to universal health insurance. So I think a lot of that is really like these conversations within the organizations and making space for that maybe a little bit more of a space to have conversations within those organizations. So we'll see. What the other interesting part about this research is when I was talking to some farmers, I asked, a lot of them talked about that they didn't want government intervention, right? Like that they don't want government help or the government to be involved. And then I asked, well, would you like USDA to offer health insurance to farmers? And they said, oh, well, that I'd be very interested in. USDA is a trusted government organization. So again, I think that this is where we need to have a lot more conversations within organizations, but then also for USDA to be in conversation with Health and Human Services, with CDC, and we need a lot more joint conversations at the national level to understand how different policies that are being rolled out affect different parts of the population, especially when we're talking about our food supply.
If I can ask a follow-up question, do you see the appetite for those kinds of programs, whether it's USDA offered or, in terms of universal pre-K, do you see the momentum and interest in those programs increasing as female voices in those organizations increase?
Yeah, I think for Beth, like, I think you're onto something about, right, like, as you hear the voices of those who are, I mean, I'll be honest, I think the best thing that happened was COVID for our research these issues, and I hate to say it, but because what happened was we went through a collective experience of caregiving through the whole country, and it was an issue that not only affected women but also affected men, and it affected folks who had young children and who were also caregiving for older family members and members who were maybe closer or further away and had to also navigate through health insurance issues. So I think that we see this as part of these larger conversations, and now we're starting to see them in the ag sector. What was also really interesting, and you're jogging my memory, for the childcare survey we just did, and we asked for a variety of what would be helpful for you, from like tax breaks to, universal pre-K to college tuition, debt to go away. The number one thing that everybody said would be the most important, this came up both in the focus groups and then also in the survey, 55%, this is the biggest thing, said that we need health insurance. Right. So that was from the childcare survey, was health insurance. And again, when we were talking to the women at the end of the focus groups, we said, is there anything else that you would like us to know that would be helpful? And we didn't have any questions about health insurance, and they all independently brought up health insurance. So you really see the convergence of these issues affecting especially young farmers, but really also farmers of all ages.
All right, I don't know if anyone else wants to go ahead and ask a question. Again, feel free to unmute yourself. I did see in the Q&A box earlier, someone had asked if this recording would be sent out to those who registered for the webinar. I think there's a way for me to do it on the back end of Zoom. So if I can, yes, of course. But if not, if you do not receive an email with that link to the recording, feel free to just reach out to me to get access to that. And so I'm going to pop my email in the chat box. The recording should be ready. Give it 1 or 2 days, hopefully.
So Amanda, just like one last point, I think for the folks on this call is like, right, food policy councils have really taken the charge in so many places to really make conversations where there weren't before. And I think a lot of times our conversations have focused particularly on the nutrition side of these equations and thinking about, well, how can food be medicine, right? How can that help people live healthier lives? How can we get better food into childcare facilities, local foods, and I shouldn't say better foods, sorry, but like local foods into childcare facilities, right? Local food into hospitals. But it's just as important to flip that question, right? And ask, how are these childcare and health insurance and healthcare access policies affecting the farm population? And they don't just end at the farm gate, but really it's about all of our supply chain, right? So when we're talking about food hubs, or when we talk about economic development through food and agriculture, I think we have to really start digging a little bit more deeply about what are these quality of jobs that we're creating. And that's going to be really important, both again for workforce retention, workforce attraction, and also just for the innovativeness and productivity of our agricultural and food system workforce. So thank you for inviting me to come on and make space to talk about these issues. And I'm just really excited to keep the conversation going with everybody.
Yeah, thank you for presenting on this, Shoshanah. I think this is definitely an area or issues that impact the food system that I know I am not deeply familiar with. And so I think you've done an excellent job of sort of distilling down these issues for us to help us understand. I know many of us who work in food systems, right, aren't actually farmers. And so this is a great kind of way to help enlighten us and show us, right, this is just another challenge, right, that small farmers are experiencing in the United States. So
all farmers, not just the small ones.
Oh, not all. So thank you for taking time out of your schedule to share this information with us. And I hope you'll come back, right, at some point and share an update on your research. And so for those of you who are members of the Ohio Food Policy Network and you are on that listserv, you will get that recording through there, and alternately I'll try to send it out through Zoom as well. But feel free to pop in the chat and thank Shoshanah for her time. I know a couple people had shared sort of how great this session has been and really got their brains churning. So hopefully we'll see some movement in the future in a positive direction. So thanks again, Shoshanah. Thanks everyone for joining us, and we'll get those resources to you soon.
Thanks
All
so
right,
much.
have a good day, everybody.
Bye-bye.